Good evening. It's Monday, July 20th, 8:11 p.m. and Warometer has reset it recently. This is going to be a very lengthy video. There's a lot to catch up with. It's going to be a worldwide update. So brace yourselves. I wanted to live stream it, but I can't. I don't fulfill YouTube's requirements, and I'm on mobile, which makes it even more difficult. Maybe in the future, but there is a lot to cover today. So get comfy because there's a lot of info to go over. First, we're going to go over today's numbers. It's Monday, which is usually when you're in the eye of the hurricane of numbers. Tomorrow should be the first day of the week, Tuesday, where the numbers start to get high. And let's find out. Today it was USA at number 1 with 62,000 new cases. India third, 36,000. Brazil third, 21,000. South Africa fourth, 9,000. In terms of deaths, number 1 is Brazil, 718. India, 496. USA 545 and Mexico 296. And let's see if we have any. Some more people reporting now. It's the weekday now. Sudan didn't. Cameroon. Let's go to the very bottom. All right, so now we looked at that. We can go to the U.S. state by state. Number 1 was Florida at 10,000. California second, 8,000. Texas third, 7,000, almost 8,000. Louisiana fourth, 3,000. So Louisiana out of nowhere. Deaths, Texas 118, Florida 90, California 56, and Louisiana 31. Well, that's interesting. If we go to the bottom, 2,000 more military men, U.S. military are now infected. It's 2 deaths, 388 Veterans Affairs, 398 more Puerto Ricans, 57 Navajo Nation. That's concerning. Very concerning. So now we can move on to let's see. Latest news. California could overtake New York in SARS-2 cases this week. If we look at the total numbers, California is only a few thousand from surpassing New York. And as I said before, New York has a population of 9,000. California has a population of 40. New York has a population of 9 million, and California has a population of 40 million. So as California escalates, it's going to become a nightmare, considering how many more people are in California. California, 30 SARS-2 cases, 16 residents and 14 staff reported at Valley West Nursing Facility in Colusa County. So nursing homes can catch a break. There's still outbreaks. It's still not near over. Seattle-based fishing vessel, the American Triumph in Alaska, has 45 crew members with SARS-2. Crew members who tested positive and medical personnel will then be taken to an isolated location in Anchorage. Now, I mentioned this weeks ago when Alaska was worried about these ships coming in, and like clockwork, it happened. California, Imperial, the worst hit county in California, is running out of tests. Health officials confirmed 75 new cases Monday. However, they also reported only 73 new tests. Pitiful. New York Giants and New York Jets said Monday that fans can't attend games, training camps, or practices because of the pandemic. Teams will play with no audiences. I know in certain parts of the world, they've built these robots that cheer on the players, I guess. It's as a way to cope. Texas, 12% of Brownsville's trash collectors are out sick with SARS-2, leaving residents behind with their trash rotting in front of their houses the past couple of days. That's starting to remind me of the movie Contagion, where the pandemic got so bad, just people weren't picking up trash anymore, and their neighborhoods just all trashed up. So this is a very, grim type of situation going on in Texas. Some Houston Fire Department members are complaining to union officials that the department is taking a week or longer to notify them if they were potentially exposed to SARS-2. First responders often don't know the SARS-2 status of patients they treat while they're at scenes. Delays in exposure notification puts many others at risk, from other crew members to employee families and the generic public. On another row, he potentially infected my crew and family in the time it took HFD to notify its members. Here where I am, I see emergency personnel pull up all the time. I don't know why. I mean, I have a feeling I know why, but these people don't. I mean, they're being called to look at a patient, but they don't know if the person has the virus or not. And if these patients have to go through this process where these emergency personnel are not going to know till over a week later whether these people had the virus or not. By then, if the patient did have it, they're already giving it to everybody that they've been around. New chicken slaughterhouse outbreak in Germany with 66 new infections of SARS-2. The source of infection was suspected to be employees not maintaining social distancing during breaks. Germany has had several other slaughterhouse outbreaks, one back in June with 1,500 infected that caused a 600,000 people lockdown surrounding Gurugram region. India. Head nurse of new civil hospital in Surat died of SARS-2 on Monday after a 16-day battle, even as Surat continued to report the maximum caseload among all the districts. On July 15th, a physician in Surat, Dr. Modi, died from SARS-2. He was hospitalized for 6 days. Another private practitioner and a pediatrician, Dr. Kapse, is on ventilator since the last 3 or 4 days on Sunday. On Sunday, another physician died in Navsari on the same day. I believe at least 20 doctors have been infected so far in Surat. Former Congress Committee President Solanki, who tested positive on June 22nd, 3 days after contesting in Rajya Sabha polls, is currently on a ventilator at CIMS Hospital in Ahmedabad. 1,366 doctors have been confirmed SARS-2 positive across the country. 106 have died. In Valsad, interns at GMERS sat on protests demanding PPE and quarantine facilities. Interns. In Valsad, interns at GMERS sat on protests demanding PPE and quarantine facilities. Indian politician Ketan Inamdar from Vadodara also tested positive on Monday. So India, just all this chaos going on in India. Their most famous actors ended up in the hospital, their families. Giant space view mass burials. Supposedly they have 25 million infected, not the low number that we show now. And it's really bad in India, and we're nowhere near, or Lamar is nowhere near where they're actually at right now. Oregon, a rise in SARS-2 cases and a testing backlog has Multnomah officials concerned. Our national supply chain testing is strained. Some people are waiting as long as 12 days for results. The long wait makes contact tracing non-effective. Vines urges use to social distance. Ohio, 2 employees at separate day supermarket locations in Cleveland have tested positive for SARS-2. New Hampshire, health officials reported 46 new positive SARS-2 cases Monday, a larger increase than usual that was partially attributed to an outbreak at a long-term facility. And I never hear anything about New Hampshire, and then this pops up. Florida, employee at Orlando CVS Distribution Center tests positive for SARS-2. Anyone exposed to employee has been placed on 14-day quarantine. North Carolina, cluster of SARS-2 cases have been identified at a casino in western North Carolina. At least 5 employees at Harrah's Cherokee Casino who work at the table game section tested positive within 2 weeks. 2 members of Brazilian President Jair Bolsonaro's cabinet said they had contracted SARS-2 on Monday. Bolivia faces surge of fake toxic SARS-2 drugs. Desperate, many infected have tried them, some already poisoned and in hospitals as a result. U.S. tourists will be barred from visiting the Bahamas beginning midnight on Wednesday, Bahamian Prime Minister Dr. Hubert Minnis announced on Sunday in an address to the island nation. Poor tourists. France has made face masks compulsory in all enclosed public spaces amid a fresh bout of SARS-2 outbreaks. California. Calabasas on Monday became the latest city in Los Angeles County to begin fining people for not wearing masks in public. An official said they are adopting a zero-tolerance policy toward parties amid the pandemic. Those seen in public without a face covering can get a $100 fine for the first offense, according to city officials. Manhattan Beach, I'm really close to that. West Hollywood, Santa Monica, and Beverly Hills have all announced fines for people not wearing masks amid the pandemic. In addition to the new fines on mask use, the Calabasas mayor said LA County Sheriff's Department deputies in Calabasas will also immediately break up any large gathering, like parties and so on, that could endanger public health, and those hosting may face financial penalties. One of Florida's largest teacher unions filed a lawsuit Monday to stop Governor Ron DeSantis and state education officials from the reckless and unsafe reopening of schools for in-person classes amid surging SARS-2 cases. Spain's SARS-2 rate triples in 3 weeks after lockdown easing. Authorities are struggling to contain a rash of fresh clusters, mainly in the Catalonia and Aragon regions. Spain peaked in April, but since restrictions on movement were lifted and Spaniards relaxed back into daily life, some 201 new clusters have appeared, with many concentrations in and around the Catalan cities of Barcelona and Lleida. The occurrence of SARS-2 has jumped from 8 cases per 100,000 at the end of June to 27 per 100,000 now. Over the weekend, 4,581 new cases were recorded, bringing the total to 264,836. More than 28,000 people have died. Where measures have been relaxed is where these clusters appear. We're talking about gatherings of extended family and spaces associated with nightlife. On Friday, the Catalan regional government began taking lockdown measures. Masks are mandatory to 160,000 people around Lleida. California. The shortage of medical equipment, including gowns and gloves, triggered by SARS-2, may be helping to spread dangerous germs within the healthcare facilities. Officials warn of a potentially deadly fungus in a Los Angeles County healthcare facility. LA County and Orange County officials are warning about multiple reports of Candida auris. I have no idea if I said that correctly. In healthcare facilities. At least one outbreak has been identified at a facility in LA County intended for healthcare professionals. C. auris is a fungus that was first identified in 2009 in Japan, but since has been declared by the U.S. CDC a serious global health threat. The yeast can cause bloodstream infections and even deaths, particularly in hospital and nursing home patients with serious medical problems, the CDC said, noting that the fungus causes deaths in more than 1 in 3 patients who suffer from an invasive infection, such as one affecting the blood, heart, or brain. Was it yesterday or the day before yesterday? How I mentioned there was another fungus appearing in another country. So it's kind of strange how that fungus was. They think there's a link between it and the SARS-2. So now we got to catch up to a lot of other information that's been compiled. SARS-2 global starvation. Hunger crisis linked to SARS-2 could kill more people than the virus. 12,000 people per day could die from hunger, linked to SARS-2 by the end of the year. The pandemic is the final straw for millions of people already struggling in a broken food system that has impoverished millions of producers and workers. SARS-2 caused millions to lose jobs, income, and has disrupted the supply chain. Humanitarian aid delivery is also at risk. SARS-2 has increased the hunger crisis. In 2019, 821 million people were food insecure, and 149 million of them suffered crisis-level hunger or worse. The number of people experiencing crisis-level hunger might reach 270 million in 2020 as a result of the pandemic, an 80% increase from last year. The pandemic is already causing starvation in Yemen, Congo, Afghanistan, Venezuela, Sahel, Ethiopia, Sudan, South Sudan, Syria, and Haiti. Brazil, India, and South Africa are also feeling a food pinch. Hunger is rising globally, and the United States is no exception. Over the last week, 1.3 million people filed initial claims for unemployment benefits. An additional 17 million people in the United States could be food insecure in 2020 as a result of the pandemic. That would bring the total number of Americans struggling to put food on the table to around 54 million people, or 1 in 6. This is a 46% increase over the 37 million people who were food insecure prior to the pandemic, based on data from 2018. Many more Americans are now desperately reaching out to food banks. 83% of the organization's food banks report seeing an increase in the number of people served compared to this time last year, with an average increase of 50%. The pandemic also exposed vulnerabilities in the U.S. food supply chains. For example, outbreaks severely affected meat processing plants around the country, causing shortages. Now, there are some areas within the U.S. that are having food shortages, and there are others that are a lot well off not having food shortages. But even if there aren't food shortages, what good is the food if the people can't afford it? You got to resort to stealing and whatnot. Another nightmare family story. Victorian family suffers from SARS-2 after near-death health battle. Michael Rojales said suffering from SARS-2 felt like he was drowning. I was just continuously coughing. I can't stop it. I just can't do anything to stop it, he said. Both him and his wife tested positive after returning to Victoria from South Africa. While isolating at home, Mr. Rojales fell ill and was admitted to the Monash Medical Center, where his lungs and kidneys started to fail and he relied on a ventilator to breathe. As his condition worsened, he was placed into an induced coma for a fortnight from March 29th, and he was on 100% oxygen. His wife was also hospitalized and found out from medical staff that her mother died from SARS-2. I remember lying there, and I was like, I can't do this. Lord just saw me, she said. I don't know what to do. I was just screaming. Staff told her they can't hold her and need to immediately cremate her infectious body. The couple have since left the medical center. However, Mr. Rojales' health battle will continue for up to 2 years. Mr. Rojales now struggles with nerve pain stemming from the infection that makes simple movements difficult, and he has lost some mobility in his feet. Corona Chan is Deng's best friend. In northwestern Pakistan, plans to disinfect tire shops and markets that had dengue outbreaks in 2019 were shelved due to funds being used for SARS-2, said Dr. Rizan Kundi, head of the Young Doctors Association. Health workers who would destroy mosquito breeding sites in India's capital of New Delhi are also screening people for the virus. Having to identify thousands of virus cases has meant that dengue surveillance has suffered in many Latin American countries, added Dr. Maria Franca Tallarico, the head of health for the Americas Regional Office of the International Federation of Red Cross and Red Crescent Societies. Experts say that disrupting such prevention efforts is ominous for the global battle against dengue. Aedes aegypti, the mosquito that spreads dengue, is most prevalent in cities, and experts warn that increased urbanization and warming temperatures due to climate change means that its range will keep increasing. Oliver Brady, an associate professor at the London School of Hygiene and Tropical Medicine, said Central America and the Caribbean were at higher risk due to overlapping outbreaks. My concern is that you have many more cases of dengue, but the capacity of the system to notify and test is limited, she said. Dengue patients need acute care, and this could lead to a double whammy that overwhelms healthcare systems, said Scott O'Neill, founder and director of the World Mosquito Program. The healthcare system is already crumbling. I am not sure how India's existing healthcare system will be able to handle this load, said Dr. S.P. Kalantri, a public health specialist. Not to mention that SARS-2 has some weird similarities to dengue. Report number 44, Corona-chan. Oh, I'm never gonna let you go. You're just too cute edition. Thousands of SARS-2 victims have been suffering for months. Many are in denial. Rather than recovered, many are calling themselves survivors. Racing heart, scalding rashes, and COVID toes, which were itchy and ulcerated, are among these symptoms. One was so delirious she heard her dogs talking. A study of 143 recovered hospital patients in Italy found that 87% were still suffering at least one symptom 60 days after illness, like fatigue and rough breathing, most commonly. Typo there. Also, U.S. CDC found among 350 people, 60% of inpatients and around a third of outpatients were not back to health 14 to 21 days after positive tests. Recovered may need ongoing care for organ damage or post-traumatic stress. I think these people feel very left out and that nobody's looking after them, said Professor Spector, whose project is tracking this. Some become really weak. Some 3.8 million people in the UK are on the app, 300,000 from the US and 186,000 in Sweden. 1 in 10 may be suffering long after labeled recovered. Spector receives daily emails from recovered people, still ill, who feel no one is listening. It's unusual. One man has constant muddling in his head and mood swings. This doesn't happen to me. I don't get depressed, he was told. He was told depression is a possible side effect. Spector said it is unclear whether these people could still be infectious. There will soon be these rapid tests in airports. Does that mean they will never be able to travel because they'll be positive all the time? We know from the first SARS, many stayed sick for years. Oh, some kids just bicycling by. It is not so much about whether you die, but even more, what of the survivors? Even young people can fall ill for months in hospitals. It seems like Russian roulette. We don't yet know what's making some people get a longer illness. There is a lot to learn still. We did that one. Antibodies fading. Vaccine hopes too. Corona Chan, a fascinating, horrifying, complicated virus. Disturbing new revelations that permanent immunity to SARS-2 may not be possible have jeopardized vaccine development and reinforced a decision by scientists at UCSF and affiliated laboratories to focus exclusively on treatments. Several recent studies conducted around the world indicate that the human body does not retain the antibodies that build up during infections, meaning that there may be no lasting immunity to SARS-2 after people recover. Warning, waning antibodies affect vaccine development, said Shannon Bennett, the chief of science at San Francisco's California Academy of Sciences. Where natural immunity doesn't really develop or last, then vaccine programs are not likely to be easily successful or achievable. People have reported vision problems, confusion, and memory issues. Cases of chronic fatigue, heart problems, lung damage, blood clotting, and neurological symptoms like dizziness and confusion have been documented in numerous patients long after the initial symptoms of SARS-2 have gone away. I've never seen a virus that get its fingers in so many biological processes all at once, Krogan said. It's a very fascinating, horrifying, complicated virus. People should not presume they have immunity. This attitude that if I go out there and just get exposed, get it over with, then I'll be immune is a dangerous presumption, Bennett said, now more than ever. Report 47, if only you could know how bad things are going to get. If only you knew how bad things are going to get. It's about to get a lot worse. Increasing poverty, joblessness. But nearly half of the U.S. population is still jobless, and millions will remain jobless for the foreseeable future. There are 14 million more unemployed people than there are jobs. Nearly a third of Americans missed a housing payment in July, and that was with the additional $600. Plus, most Americans have already spent the stimulus checks they received at the beginning of the pandemic. Oh, those only lasted a few days. People were begging for those, and who knows how they're doing now. I'm pretty sure many went homeless or had to move back in with family or friends. We should be very concerned about what's going to happen in August and beyond, starting with a spike in evictions. Matthew Despart, who leads the Social Policy Institute at the Washington University in St. Louis, tells Axios. Expect more furloughs and layoffs. By economists' estimates, more than 100,000 small businesses have permanently closed since the pandemic began. For those that are hanging up, loans from the Paycheck Protection Program have not been enough, and the back and forth between reopening and then closing again as states deal with the new case waves has been devastating. In fact, rates of closures have started increasing. If I could cut in here, that's one of the reasons why some gyms or bars or shops are defying lockdown and saying they're going to open up anyways. It's not that they don't believe in the virus, it's that they need the money from, losing everything. So, the big firms aren't immune either. Just last week, behemoths like United Airlines, Wells Fargo, Walgreens, and Levi's either cut jobs or told workers their jobs were at risk. The school situation. Since schools sent kids home in March and most summer camps didn't open their doors for the summer, working parents have been dealing with a child care crisis attempting to do their jobs. The situation is more dire for low-income families with kids who rely on school lunches and for the single parents who are juggling work and parenting without any help. Now the public health care crisis hasn't abated, and school districts are running out of time to figure out what the fall will look like. Some, starting with Los Angeles, have already decided to go online. If you want to know what's going to happen if America opens up the school, look at South Africa. Check out what happened in the schools in South Africa. If you want to know what's going to happen if the U.S. opens up the schools in the next coming couple of weeks. And some people don't even want kids to wear masks. And we have studies saying that kids can be as infectious as adults. Report number 48, even more reinfections and vaccine worries. Oh, this one was a good article that I stumbled upon. Israeli doctor reinfected with SARS-2 3 months after recovering. The doctor suffered from a fever, cough, and muscle pain when she tested positive back in April, but recovered and tested negative for the virus in May and June. Earlier this month, the doctor came in contact with a confirmed patient and tested positive for the virus yet again. This is the second case at Shiva Medical Center, in which a patient recovered from the virus and was subsequently reinfected. Another patient at the hospital recovered and returned to the hospital with severe lung inflammation. It's the latest in a series of incidents of suspected reinfection that have raised questions concerning how long immunity lasts. Last week, Dr. Maria Van Kerkhove, the World Health Organization's WHO SARS-2 technical lead, explained that there are a number of studies attempting to figure out how long the protection provided by antibodies will last, and that some initial studies have found that they may wane after a couple of months. Now, the WHO, the World Health Organization, does not want to talk about this. In fact, that's the first time that I even saw them talking about it, which is through this article. With some coronaviruses, such as SARS and MERS, people had some form of immunity for about a year or even longer. But with other human coronaviruses that circulate regularly, the immunity period is much shorter, Kerkhove explained. The WHO officials stressed that this is early data and that more studies are needed. That's their excuse to brush this off. It's early data when there's all this evidence out already. Preliminary studies in China, Germany, Britain, and elsewhere have found that patients infected with SARS-2 make protective antibodies as part of their immune system's defenses, but these appear to last only a few months. That raises big problems for developers of potential SARS-2 vaccines, experts say, and for public health authorities seeking to deploy them to protect populations from future waves of the pandemic. To be truly effective, SARS-2 vaccines will either need to generate a stronger and longer-lasting protection, or they may need to be given regularly, and those things are not trivial. Report number 49. Are the original SARS chronic infections in some coming back with SARS-2? Example 1. Daniel, 28, caught SARS-2 in March, which left him coughing blood. However, extreme fatigue and tiredness still go off and on. He has daily brain fog, difficulty concentrating, and problems with short-term memory that were making reading, writing, and speaking harder. Today, he's too sick to work full-time. Example 2. After recovery, a 30-year-old man joined the long COVID support group where he and 6,000 others talk about still feeling sick after recovering. He wonders if his immune system is compromised. Example 3. Swank, 28, got sick around Christmas and tested positive for SARS-2 antibodies in April. A non-smoker and gym goer, she now needs an inhaler to work out due to long-lasting damage. She is afraid of her immune system won't be able to handle another illness. Since this, I have heard of other cases where inhalers seem to work. We'll probably be hearing about that. And I know some hospitals are already using certain kinds of inhalers. Example 4. Jordan, 29, tested positive for SARS-2 twice. The first time was in April. SARS-2 partially collapsed one of his lungs. He eventually got better and tested positive for antibodies, donating blood plasma thinking he was immune. Then in June, the suffocating returned. He was winded and from just folding laundry. He tested positive again. I just sat there and shook my head. I didn't want to go through it all again. It was awful. Example 5. A recovered 24-year-old college student who got sick back in March is currently furloughed from his job during the pandemic. But even if he wasn't, he doesn't feel fit to return to work. His functioning is only at about 75%. Just walking up a few stairs is a challenge. I saw doctors bringing out dead bodies every day. I heard ambulances probably 50 times a day. I'm glad that I'm alive because a lot of people my age died. He warns the young aren't immune and that long-lasting symptoms do exist. We're nervous. We have a disease you guys don't know enough about. We survived it, and now we have symptoms that are coming and going. I hope that it's not chronic and that I don't become bedridden. I have a long life ahead of me. Report number 50. Peru SARS-2 corpse collectors. Dressed in PPE, the two men collect the bodies of people who died from SARS-2 in and around Lima. It's a job few want because of exposure to the virus, but these two Venezuelan immigrants are taking the risk out of desperation for money. We are scared we can get infected and take it home, where I live with my wife, children, and mother, Vargas said. He cradled his cell phone with a photo of his wife and children as his screensaver. In every house they witness families crying out for their lost loved one. Most bodies collected are from poor neighborhoods, from homes where they can't afford burials. There have been more than 13,000 SARS-2 deaths, and the health system is collapsing. What's left for the poor is deaths with no dignity. One family called an ambulance that never came and had to watch their loved one die, and Vargas and Serpa came for the body. As the family grieved, Vargas and Serpa put Oliveira's corpse in a black body bag and they went off to the crematorium. The Peruvians don't do it. It's tough, said Ortega, who works 7 days a week, earning money he needs to support 3 children in Venezuela and a toddler in Lima. He says he never imagined he would see so much deaths, but that somebody has to do it, and we need work. Ortega, 40, is in charge of the ovens, which operate constantly. A pile of cardboard coffins is stacked nearby. These are not even all the bodies. There are bodies elsewhere because there is no space and we cannot leave them outside. I wouldn't wish this job on my worst enemy. I've heard that so many times. I would not wish this on my worst enemy, whether it's a job or being sick, being a doctor, doing or cremating like this. I've heard that too many times, that they wouldn't wish it on not even their worst enemy. Around 11 p.m., their final call of the day came from Triunfo Hospital. The staff asked the man to collect 13 bodies because their morgue was overflowing. These grueling days have become their norm. Sometimes we get home at 3 a.m. After we shower and eat, it's already 4 a.m., Serpa said. We're up again and have to leave at 8 a.m. Then it's the same all over again until the next day. Report number 51, Hazard Pay Edition. Despite rising SARS-2 deaths and cases, companies are getting rid of hazard pay, also called hero pay, which is extra hourly pay given to employees for working in dangerous jobs. Susan, a clerk at Food for Less in Los Angeles, stopped getting an extra $2 an hour hazard pay in May, but her fears of contracting SARS-2 at work didn't end then. We're out there every day dealing with customers not complying with safety measures, like wearing masks. Some customers had even spit on the floors after being told they couldn't enter without a facial covering, she said. The way I see it, hazard pay is a small price to pay for what we're dealing with every day, Hernandez said. We are putting our lives on the line. Hazard pay, known as danger pay, outside the United States, originated in the military during World War II, when soldiers, reporters, and entertainers received additional compensation for assignments in war-torn areas. The SARS-2 pandemic was the first time grocers implemented hazard pay, according to Bronfenbrenner. Companies used the first reopen as an excuse to eliminate hazard pay, but essential workers are still dying. Senator Elizabeth Warren, Sherrod Brown, and top Democrats sent a letter Thursday to the leading 15 grocery chain CEOs, calling on them to restore hazard pay for workers during the pandemic. Labor advocates say there is a clear moral reason that essential workers should get additional compensation. The United Food and Commercial Workers Union said at least 93 of its grocery work members have died from SARS-2 and released a poll of 4,000 members Friday that found that nearly half said they were more concerned about SARS-2 than they were 2 weeks ago. Ending hazard pay... Ending hazard pay makes no sense, said ULCW President Mark Perone. Our members and grocery workers across the country continue to show up to work during this pandemic, risking their health in order to serve our communities. I had received hazard pay at some point, and they got rid of it really, really fast. Back when I was employed in that very shady retailer. Report number 52, Facebook's anti-mask groups edition. Facebook has removed one of the largest anti-mask groups on its platform for spreading misinformation about SARS-2. The About section of the group, Unmasking America, which had more than 9,600 members, says, here to spread the truth about masks. Get a load of this. It made several claims which have been widely debunked about masks obstructing oxygen flow and having a negative psychological impact. It is a psychological anchor for suppression, enslavement, and cognitive obedience. When you wear a mask, you are complicit in declaring all humans as dangerous, infectious, and threats, the group say. The group has photos of people wearing Make America Great Again masks as a way of protesting mask requirements. The group is also sharing fake mask-wearing exempt cards. Yeah, I remember pointing that out weeks ago. I guess it's still a thing. Among the private groups are the Million Unmasked March group, which has more than 7,800 members. Million, all right? Parents are powerful. We are a group of moms, dads, grandparents, uncles, aunts, teachers, friends, nurses, and anyone who is concerned with our children wearing masks to school in fall. The group's About section reads. See, this is why people are laughing at America, because of things like this. And somewhere in the distance, Judy Mikovits is laughing on a pile of money. We believe that all children wearing masks to school is physically and psychologically damaging. Join us in saying no more masks, and the Unmasking Fear group, which is about 400 members, is promoting an August 1st event rallying against mandatory masks. Well, at least they're gonna wipe themselves out with that event. Facebook has taken several steps to attempt to stem the flood of SARS-2 misinformation on its platforms, with mixed results. A scathing report in April from human rights group Avaz found 100 pieces of misinformation regarding the virus on Facebook were shared more than 1.7 million times and viewed about 117 million times. Facebook announced April 16th that it was adding a warning label when a person liked, commented, or reacted to a post with fake SARS-2 information. And I got one more for you guys. Report number 53. Georgia nurse shares her experience. It gets the best of you. Nurse tells what it's like on SARS-2 floor in Coliseum Medical Centers. Over the last 4 days, nurse Erica Borden has documented each of her 12-hour shifts working with COVID-19 patients. Today has been an extremely rough day. Losing patients is never fun. No matter what you do to try to save them, it kind of hurts worse when you're the last person they see, dressed up all in this gear and not a family member. It's rough, mentally, physically, emotionally. It gets the best of you. I know everyone thinks wearing a mask is just games, but honestly, it could save your life or save your loved one's life or just a random person. Having to call family members today wasn't fun because patients, they were digressing, going back to square one, because square 2, 3, and 4 were clearly not working. You can just hear the heartbreak on the phone. It's kind of like your heart breaking is what they're going through, but yet they're not able to see their family members and actually see what's going on. They have to take our word for it. We have patients on the floor ranging anywhere from 25-year-olds to 92-year-olds. This virus doesn't care how old you are. I see 92-year-olds beat it, and I've unfortunately seen younger people in their 20s and 30s have to be incubated and not come off the vent. That's kind of where we're at. It doesn't matter how old you are. If a bunch of y'all think this is a hoax, it's not. I bite my tongue when people say that to me. I'm like, no, come work on the floor and you will see what it's actually like. I come home every day mentally, physically, emotionally exhausted because I give my all there. When I get home, I got nothing left to give my fiance. We both are in this building. We both know what it's like, and it's hard. It's hard. So this is where we're at right now. The world is collapsing under this virus. As the government say, the complete opposite of reality, while they cover up the numbers, cover up the deaths, lock up and disappear people who are whistleblowing and talking too much truth, trying to rush vaccines out that could do the opposite of what they're supposed to do if they don't go through the safe trials. And all the time we have to blame China for refusing to make us aware of this back in December, for doing what they did to Chen Qiushi and Fang Bin and Dr. Li, for disappearing reporters, doctors, other journalists who were trying to tell the truth, for covering up their numbers, covering up their deaths, and for just toying with these types of viruses in labs. I mean, where are we now? We go back to the very, very first report. The non-vulnerable asymptomatic infected are the ones super spreading and don't even know they are. Masks are not just from their protection, but others' protection from them. We just got a paper the other day that a lot of people who are asymptomatic are actually symptomatic, but the virus has a way to act as a pain reliever. And so that explains why doctors are confused, because they're having patients come in who are infected, who feel normal, but their CT scans show organ damage, or they're in hypoxia, where they're not receiving enough oxygen, but they appear normal. If, according to this paper, it could be that it's because, as I said, the virus blocks the ability of you to feel pain. Meaning, this virus is so infectious, we are finding out now ways that this is potentially a million killer virus. If it can do things like this, possibly. So at least with SARS, you knew it would not be infectious till you showed symptoms, but you knew you would have symptoms. With this virus, you could be dying and not even know it, think you're normal, and spreading it all over the place. And if this paper, can get through to the mainstream, it means that SARS-2 is much more lethal than we think it is, because we have potentially hundreds of thousands of asymptomatics that are actually in pain, but are not going to the hospital because the virus blocks them from feeling pain. And if that's true, then it means that this virus can hide itself to be more infectious, and also hide itself to make it appear that it's not so harmful. Now imagine if it couldn't block the feeling of pain. Imagine how much overwhelmed hospitals would already be now. if many of these so-called asymptomatics could actually feel the pain. Corona China came to America much earlier than reported. We had pneumonia outbreaks in America all last year. No one talked about it. It was the mystery pneumonia that nobody could figure out and that nobody can still figure out. And the government does not want to touch those cases from last year. Does not want to touch them. 5 million left Wuhan for holidays right before the lockdown. China allowed this. We can never forget that. We have to always call out China for their crime and allowing this thing to spread. I wish more people that cover the virus would rightfully call out China, because some people are too afraid to call out China. I'm not going to name names at this moment, but there are people who just do not want to put the finger on the Chinese. They want to, and what they said that I heard people praise China's lockdown measures. Yeah, welding people in their homes, starving them to death, is worth praising as a lockdown measure. I don't think so. Opening of non-essential business increased spread. Yeah, we saw this happening now. That part of the outbreak is because, not just because the country's reopened too early, people just didn't care to take any kind of precautions. It's a combination of things. Opening too early, people not wanting to be informed, people being misinformed, the virus not being understood how infectious it is, and just a combination of things. And the pandemic is also a part of this. All the grifters and liars that are telling us that the mask is fake to make $1 off of human lives. Hong Kong was testing everyone going in and out and monitoring those testing negative as well. In contrast, Singapore did not do this and had big community spreads. Yeah, some countries just didn't care to do any of this. And now we've seen what the consequence was. Contact tracing and quarantine is a must to prevent spread. America wants to end the quarantines, which they could have done, but in a safe way, but didn't. They do not. The government is taking money away from contact tracing. Contact tracing is already overwhelmed. Contact tracing is already failing all over the country. I mean, it's a disaster. Without these measures, community spread will happen and restart containment process. Yeah, countries all over the world right now are restarting. They're restarting because they failed to contain it. Timing is essential. Too many countries acted too late. Obvious. Can herd immunity work in the U.S.? No, absolutely not. It requires 85% of the population to be infected to have herd immunity. By then, 20% of them will need to go to the hospital, which is out of the country's health system's ability to control. Even if 1% of the population is infected, that would already overwhelm and collapse the healthcare systems anywhere, not just the U.S. Yeah, like when New York was overwhelmed, when Italy was overwhelmed, when Spain was overwhelmed, China was being overwhelmed. They had a small population infected. Now, we take what Boris Johnson wanted to do and just let it spread to the community and just go for full herd immunity, the problem would multiply many times worse, because you will have a significant increase in sick Russian hospitals than we already have with low numbers back then. So no, herd immunity is not going to work. Not at all. People do point to Sweden, but they did take lockdown measures, and they actually sacrificed their old to do their own, type of herd immunity. And now their testing is horrendous, and they probably have many more infected than possible. They're still having outbreaks, and it's not over for them at all. No way at all. Not whatsoever. U.S. not testing well, and never did, and it never will. They're just the U.S. government is unable or unwilling to test. We know that already. It's obvious. Average person doesn't seem to be aware that the virus can survive and be infectious for up to 17 days, as in Diamond Princess study. It's airborne. It can attach to your hair, attach to your skin, it can attach to your clothes, it can attach to your shoes, it can attach to your phones, it can attach to your groceries, it can hang in the air, it can float in the air, it can move in the air, it can hang out in the water, it can come out of feces on the floor next to you, it can come out of urine, it can come out of liquids, it can survive on stainless steel, plastic. I mean, it goes on and on and on. It sounds obviously like a lab agent. I mean, if you really, really don't want to, if doctors and their PPE are catching this thing by the hundreds of thousands all over the world, you need BSL-4 type PPE to survive this, because it just seems more and more like it's a lab agent at this point. Italy responders are traumatized to see healthy 25-year-old infected suddenly drop dead from heart attack. A colleague told her story. This is a virus that invades your body. Depending how you get it, through your eyes, nose, mouth, cuts, it gets in, it spreads to your organs, it damages all your organs, it goes into the blood, it attacks your blood, it clots your body up, It causes you to get amputations. It causes you to get severe lung damage, kidney damage, liver damage, brain damage. It's messed people up horrifically for months now, and we still don't know what else. We still don't have a good idea of what else of what it can do at all, because it's still a mystery. Doctors are still scratching their heads. There are still papers trying to get to the bottom of it. They still can't crack it. I just I don't understand. If public continues to remain ignorant to what the virus can do, they think they are immune from it and go out and protest. Yeah, I mean, if you follow this channel, you've seen that people are gonna learn the hard way, and they chose that path. They chose to go down that way. If public continues to remain ignorant to what virus can do, they will think they're immune from it and go out and protest. Now, oddly enough, I haven't really come across much from the protests, but we know that the contact tracers have been discouraged to contact the virus back to protest. So maybe there's more to it than that. So when will it be over? When will it be over? Unfortunately, at least 2 years if we are lucky, and we don't have a second wave, and we find a vaccine. As I've mentioned before in this video, everything that I said, this can be here for a decade if it's not controlled, and it's not being controlled. 60 to 80% of people on ventilators are dying because of multiple organ failure. But yeah, most of the vents die because they were being treated the wrong way. And so this is where we're at today. It was a lot to cover, but now I'm up to date on everything that's been compiled. So thank you for this. Was a long one. So this was a long one. So how long were we doing this? This was 46 minutes. But I tried to be fast. I try to be really, really fast because there's a lot of content creators, and many of them live stream, like Lookner, and we have Kevin. And I don't want to, take up too much time, so I try to go as fast as possible, but still make sense, still get the message in. We do have other people out there besides them, like Peak Prosperity, who I would definitely recommend watching. There's also Steve Lookner, but he's been going more towards other live news, but in the past he was strictly focusing on SARS-2. And so that's today's video, and I'm getting busier. Like the past couple of days, especially, I'm spending more and more time digging all this up because it's just so much happening. It's as the pandemic gets worse, I get more busier. And again, I'm unemployed. I lost my job. I'm running off of my savings. I have the time to do this because I have nothing better to do. I have nothing better to do than to do this. And it's intense, every day reading hundreds of headlines, opening up dozens of tabs, scanning each one, copying, editing, pasting, cutting, and just trying to find the best points. Google, just searching up different terms, different words, different key terms, trying to dig up all the articles that I can, looking through the studies, reading all this. And again, I have no skills. I have no academic background. I'm a college dropout. I'm not good at anything. I'm not an expert on any of this. I just put so much time into studying it and learning in it that I kind of began to at least understand a little what's going on. And as we go on, we're going to be in for a rough ride. And I hope that you continue to stay informed, inform others. If you can, subscribe. If you can, hit the bell. You're going to be notified. Ask a question if you want in the comments. Just share it if you can. I don't really have a big following, but that's not what's important. What's important is to just get out the message. If I can save at least one person with this, it's good enough for me. And thank you for watching, and I will see you tomorrow.